video is going to show you different ideas to get yourself out of pain when sitting. This is particularly helpful if bending forward or slouching in a chair bothers your pain. This could be like a car seat that has like a bucket seat where you're kind of like positioned like this, or maybe sitting in a low couch where your knees are higher and you're just kind of lounging and you start getting back pain. So one of the ideas is to put your pelvis in more of an anterior tilt position. So I'll show you what I mean by this. If you can picture the two bones of your hips on either side is like a dumbbell. It's like a rod, and then you can feel your two hips on either side. So basically when we roll our pelvis forward like this, that's kind of what happens with our pelvis. And so when you roll your pelvis forward, you don't just lean forward, you naturally want to stay righted toward eye level. So if you put your hands on your spine, when you bring your pelvis from kind of like a slouch position to rolling your pelvis forward, you can see how it creates more of a curve in your back, or we call that extension, lordosis in your back. This is a better position generally, just because it's neutral spine position for your back when you're sitting. So a lot of times if you feel like you need more of an arch, a common thing is just to get a lumbar roll on Amazon and stick it into the lordosis to push your back into extension. That can be helpful, but with my 15 years of experience, what I found is more helpful is putting your spine in a good position from the bottom, meaning the base of where you're sitting, versus just pushing your back into a position that you want it to go in. So I'm going to show you two ways of doing that. And the first way is when you're in your car, you want to manipulate with the chair position. Oftentimes the higher the seat, the better it feels in your back. And then tilting the chair downward like this, if you have a control for that, is ideal. So try that first, just without any pillows or anything added into your car seat, or, you know, same goes for your work chair. You could tilt the seat downward like that if it does have that control. If it doesn't, no worries. We're going to help your pelvis roll forward. So it's called an anterior pelvic tilt, to create that natural curvature in your spine by changing the seating position that you're on. So a couple ways of doing this. If you take a normal towel, like this, a bath towel, and you just fold it lengthwise in half, just like this, and then fold it in half this way again. So right now it's just kind of a long rectangle. So then what you can do is you can fold it so that it's not quite to the edge, but you're leaving kind of a stripe on the bottom that doesn't have the towel on top of it, and you're also leaving a stripe on the top that doesn't have a towel on it. And then you want to fold this top part over so that it's in line with the bottom folds. So you can see here how it's thicker, a little less thick, and then thin on the bottom. So what you want to do is you want to take this whole thing and put it in the very back of your chair. You don't want to put it here, because then you're going to fall on the other side of the chair back here. You really want to scoot all the way to the back of your chair. And then you want to sit on it and see how that feels compared to taking it out and not sitting on it. Which one feels better to you? If you notice a big difference in your back symptoms with the towel, then I would use the towel. And I'd use it every time you sit down in a chair. You can have different towels in different places you sit, like in the couch, in your work chair, and then in your car chair. If you don't like the feel of the towels, you could just take a pillow that's kind of like a roll or a small throw pillow or something like that, and do the same thing where you're putting it in the very back of the chair. The idea is you want your knees lower than your hips. You want to tilt your pelvis forward by sitting on something in the back of your chair. So those are a couple ideas. You can try different sizes, different heights. You can do 2 bath towels so you're really tilting down, and just see what works. If you think about how much you sit, whether it's your commute to work or how much you sit in your work chair, making these small changes where you're more comfortable will have a huge impact in your pain, more than doing specific exercises. So hopefully some of those ideas work for you. Take care.